I'm Brad Sharpe. I'm the Division Chief for the Division of Hospital Medicine at UCSF Health. Thank you for your interest. You know, these are challenging, interesting, unprecedented times for all of us. I am incredibly proud of our response to the COVID-19 pandemic in our ongoing efforts to be more anti-racist and in the management of all of our ongoing clinical and other enterprise. And I personally am looking ahead with hope and optimism to 2021, including the hope and optimism of having outstanding faculty join us the next academic year. The goal of this video is to introduce you to the division, to learn some of the basic things you need to know about what makes it special, what makes this division special. We can't cover it all, but this should provide an introduction to some of the core parts of the division and what makes us tick. I will say I'm a little biased, but the division's a pretty special place. And hopefully, as you learn more, you'll see why. That the division is a special place, sits within UCSF, which is a special place, and sits in a truly fantastic city. So with that, I am going to use some slides. So let me show you my slides here. Mode. So here's the roadmap or the agenda we're going to cover in the next 10 to 15 minutes. We're going to talk a bit about the history of the division. I'll talk about our mission, our vision, and our values, break down the clinical services, our academic functions, talk about the importance of faculty development and mentorship, our efforts in social medicine, and finally life in San Francisco. So first, history of the division. So the division was founded in 1996, actually by Bob Wachter and Lee Goldman. Bob Wachter, sometimes called the father, or I would say grandfather of hospital medicine, and they coined the term hospitalist. At the time, there were probably 1,000 or so people in the country that were doing the work of a hospitalist, but they didn't have a title, and they gave it this title. And since then, the field has exploded. There's now more than 70,000 hospitalists across the country, and this division was founded with this idea that this is a better way to care for patients, a better way to teach inpatient medicine, and a better way to improve overall care. We were part of the Division of General Internal Medicine until 2007, but our growth has exploded. We are now the largest division in the Department of Medicine at all of UCSF with more than 100 faculty and 30 staff. And what's our mission and our vision? Our mission is why we exist. So we exist to provide the highest quality and equitable clinical care, education, research, and innovation in academic hospital medicine. We want to be great at everything we do. And fundamentally, our idea is that we want to impact the care of patients right down the hall, right out there, and patients within hospitals in the rest of the country and the rest of the world. And the vision is how we're going to get there. Is that we want to be the best division of hospital medicine by promoting excellence, integrity, equity, innovation, and professional satisfaction among our faculty, trainees, and staff. That fundamentally, as a division, we are successful collectively if the individual faculty and staff are collectively successful. And what are some of our values? What are the things we value? So one of them is hiring truly outstanding faculty and staff, and then supporting them in their work, making sure that they feel supported, that if you were with us, you would feel supported in all that you do. We commit to being responsive to concerns and challenges. We have an anonymous survey every year where we track things like burnout and satisfaction, and are you finding your niche, and do you have mentors? As well as every month across all of our services and functions, we have opportunities for feedback, and we want to be responsive to those concerns. And lastly, we support a culture of collaboration, innovation, and excellence. This is a picture of our group at pre-COVID, of course, at one of the national meetings, and a collaborative group working on a project together. And we're very proud of that collective, collaborative spirit. Now, a few words about our clinical services. That we are, at our core, we are a clinical division. And I am incredibly proud of the care that we provide and all of our clinical services. And here they are. We are currently staffing at this site and a couple other sites, 9 different clinical services. And basically one way to think of it is on any given day, we are interacting with, say, half of the patients that are in the hospital at UCSF in one way or another. Now here at Parnassus at the core is our teaching service. That's an opportunity to work with truly amazing house staff and students, and everyone who's an academic faculty member spends some time on the teaching service. Then we have a mix of direct care services where you as a hospitalist will be taking direct care of patients, as well as co-management or consult services. For some of our faculty, you'll notice one listed here is the St. Mary's Hospital Medicine Service. Some of our faculty are based at St. Mary's Hospital, which is a community hospital. It's 1 mile away right out that window, where we oversee all of the hospital medicine inpatients there and manage that service. They do have a residency, a St. Mary's Internal Medicine residency, so it does create an opportunity for teaching as well. We're very proud of the work we've done there, that we have faculty who are based there, who spend most or all their time there. And then we have faculty that are based here at Parnassus that do some of their clinical time there as well. And that would be an opportunity for anyone who joins the faculty as an academic hospital member. Now, a few other words about our clinical services. So sometimes tertiary and quaternary care hospitals get a reputation for not having a diverse patient population. Well, that is not true for us. That our patient population reflects the diversity of the city of San Francisco, that about 30% of our patients are Medi-Cal, another 30 or 40% are Medicare, and somewhere between 20 to 30% of patients, their primary language is something other than English. So you will be exposed to incredible diversity of patient population here. Clinically, we commit to making sure the jobs are doable. That the language I use is quite simple. We want you to be proud of the doctor that you are that day. That we want you to be able to be the doctor you want to be. So that is if you need to spend an hour in a family meeting with a patient or family, if you need time to call the daughter of the patient at the end of the day, you need to go back and check in on how the patient's abdominal pain is doing, you will be able to do that. We keep our caps very reasonable. For example, on our direct care service here at Parnassus, the cap is 10. Typically, it's 8 or 9 patients per hospitalist. At St. Mary's, the cap is 12. It typically runs around 10 or so. We want these jobs to be doable, where you can be a great doctor and be satisfied. We also have very few to no 12-hour day shifts. Our day shifts are either you sign on and leave when you're done, or they're 10.5-hour day shifts. And then also, we want faculty to be on services they want to be on. So over time, many of us have changed our clinical schedules to say, I want to do more of co-management, I want to do more of direct care, and that can be adjusted over the course of people's careers. So in addition to being a clinical division, we have core functions, core academic functions, and we are very proud to be an academic division. That all of our faculty, all of our academic hospitalists have some academic interests. And our job is to make sure that they are supported and be able to have the mentorship and the guidance support they need. And this is some of the domains where we have expertise and we have faculty that this is their academic interest. Some people have an interest in clinical excellence or clinical problem solving, diagnostic reasoning, some in quality and safety and value, medical education, traditional research and scholarship. We have global health hospitalists. We have informaticists, point of care ultrasound, social medicine. So hopefully you can look at this list and see places where you could see yourself fitting in. But if you don't, we're open to that as well, because fundamentally, we want to harness the intrinsic motivation of our faculty and help them drive forward the academic enterprise that exists within the division. And we have a long track record of academic success. So this involves presentations and abstracts at regional and national meetings. We have more than 1,200 peer-reviewed publications since 2008. We had 95 in 2020 alone. And then we have leadership roles across UCSF and beyond, that we have hospitalists that were running medical school courses, that are service leaders, that are QI leaders, the chief medical officer, the chief health information officer. We have essentially hospitalists as permeating across the leadership, and that is a path forward for many of our faculty. And how do we get there? How do we support you? Well, I say quite simply to our faculty, your job is just to have ideas, to have stuff you're excited about, and we're going to surround you with what you need. So there's your idea there in the middle. And we're going to provide methodologic expertise. We're going to provide data if you need it. And we're going to provide project mentorship to help you drive that project forward. Maybe you've never done a project before, but we're going to help you do it. All you need is that idea. We have a couple ways that we support this academic enterprise. So we have something called the project tracker and the project pathway. This is a place where we collect all the projects going on in the division and make sure they're working collectively. So what this would mean for you, if you were a faculty member, let's say you have an idea. Let's say you want to work on differences in opiate prescribing for different races. Say you wanted to work on efficiency in the EHR of interns, for example, that you put that in the project tracker. It would go to our research core. They would look at it and say, oh, you know what, I think this feels more like QI or more like med-ed. They would have you meet with a mentor and then figure out what data you need, what methodologic expertise you need, as a pathway to get you the support you need. We're also very proud to have an academic research coach, one of the first in the country. Currently, she's a master's epidemiologist whose job is to support all of us, to help you turn an idea into a project and a project into a publication or dissemination. And lastly, we have an incubator. So we have basically a weekly works in progress session where you get to bounce your ideas off other faculty and fellows and trainees in the division. Tons of ways that we support this academic enterprise and help you be successful in that domain that you are passionate about. We also believe strongly in faculty development and mentorship. So for faculty development, we have a very robust faculty development program for new faculty and fellows. It involves a comprehensive onboarding. We have a 3-site boot camp with the 3 other hospitals at UCSF. All new faculty and fellows are enrolled in the Stanford Faculty Development course, which is a class on teaching skills where we teach teaching skills. And there are multiple ongoing series. And this faculty development program was initiated 10 years ago. We published on it in the Journal of Hospital Medicine, and we've evolved it over time to meet the needs of our new faculty. And then we have ongoing faculty development across the division. So we have our own monthly grand rounds. We have a really cool thing called Cases and Conundrums, which essentially is report for attendings, that it's attendings and fellows talking about cool, interesting cases. That before COVID, we would have lunch together on Fridays. Now it's virtual. We hope to get back to in person, but just a chance to talk about interesting cases or challenging cases. And then we have multiple ongoing sessions. For example, this week at our Monday meeting, we had a session on how to support patients with hearing difficulties, those that are hard of hearing or deaf, given by a medical student who has hard of hearing, and unbelievably practical tips on how we can best communicate with patients who are hard of hearing. So really committed to a robust faculty development program. And then also committed to mentorship to help faculty like these 2 here present nationally, present their work at national meetings. That we have a structured mentorship program for new faculty and fellows where you are assigned a near peer mentor and a senior mentor. And then a structured faculty program for faculty in years 2 through 8, where you get to meet with 2 of our experts in faculty development to help you build your individual development plan and help make sure you have the career and project mentorship that you need. That we know from our experience and from the literature that mentorship is incredibly important to achieving academic success. And we have many mentors to choose from. It's one of the benefits of being a division that's been around for more than 20 years. And here's a list. You can peruse the different people. These are senior faculty who are all willing and able and excited to serve as mentors for faculty and fellows who join the division. A few more words. A word about social medicine. That I want to talk about our efforts as a division in this domain we call social medicine. That we've had a long-standing commitment to principles of social medicine, and we have what we call the Social Medicine Core, which is a group of faculty who have a shared interest in principles around 3 things. One is diversity, equity, and inclusion, making sure we have the most inclusive learning and clinical environment. Second is disparities in care and serving our vulnerable patient population. And third is healthcare advocacy, that we've had efforts in this domain going on for the last 3 years. But clearly the events of this year refocused and reshaped our view on this. The hard to watch images of police violence and the protests and the realities of structural racism and the disparities in COVID infections and outcomes have sort of shined a new light on the importance and how much work we have to do. And we are committed as individuals and as a group to doing our best to combat racism, to restore justice, that we are committed to being leaders in health equity and justice in academic medicine. We have multiple domains that have launched this year. We have an anti-racism task force. We have a diversity recruitment task force. As you'll see on the website, we have a junior faculty diversity award and additional protected salary for junior faculty as a way to enhance diversity. And then we have a DEI, diversity, equity, and inclusion summer internship for medical students. Our goal is to have specific concrete projects, but also to have these principles of social medicine permeate across everything we do, whether that's informatics or point of care ultrasound or the clinical domain or medical education, that we're fundamentally, again, committed to being leaders in health equity. We're not perfect by any means. We have work to do, but we're committed to doing the hard work. And lastly, a word about life in San Francisco. That, as I said, this is a pretty special division that sits within UCSF, which is pretty special, that sits in San Francisco, which is truly an amazing, vibrant, open, just unbelievably beautiful city. And we want to support faculty, those that want to build a family. So these are a picture here of our daughters, 2 9-year-old and 6-year-old daughters on Halloween, and those that don't want to build a family. That we fundamentally want faculty and staff to have satisfying and fulfilling careers, but also satisfying and fulfilling life outside the hospital and a chance to really enjoy what is like a truly magical and amazing city. And I'll add one more thing, a silver lining. There have been multiple silver linings from the pandemic, but there's this one, which is rental prices have actually plummeted in the city. It's actually a great time to move to San Francisco. They've gone down by 20 to 30%. They're still quite high, but rental prices have gone down quite a bit. It really is a great time to be moving to San Francisco. So that's a brief introduction to the division. Again, I can't answer every question you might have, but that tells you a little bit about who we are and what I think makes us makes it pretty special. I want to thank you for your interest. I'm very proud of the division of what we accomplished over the last 25 years. I'm excited about the future, and that, again, we are committed to helping and supporting individual faculty, that if individual faculty thrive and succeed, then collectively we thrive and succeed. And so as I head into 2021 again, I head into the year with optimism and hope. Optimism and hope as hopefully we turn the corner on the pandemic and we continue to do all the great things we do as a division. And hopefully you find what you're looking for in the Division of Hospital Medicine at UCSF Health. Thank you again for your interest. Take care, be safe, and be well.